Hello, everyone. I'm Anissa. I am 17 years old. I'm a senior in high school, and I'm from New Jersey.
Hi everyone, my name is Celeste Virador. I am also 17 years old and a senior in high school, and I'm from California.
And hi, everyone. I'm Emily Brown. I am the founder and CEO of Food Equality Initiative, and I'm from Kansas City.
So this is Celeste and I's second year on TAG, and this is also our second year doing a project that addresses food insecurity. Last year, we worked on a project that focused on the accessibility of food banks for those food insecure individuals that also have food allergies. And this year, we're focusing on food insecurity again, but just in a different way through our project FAPI with the help of Ms. Brown, of course.
FOFI stands for Food Allergies and Food Insecurity. When COVID-19 was declared a pandemic, Anissa and I knew that we couldn't continue with FOFI as we had originally planned, so we decided to rework the project to focus on the current situation. As schools shut down due to the pandemic, many continued their meal assistance programs for food insecure students. However, due to lack of preparedness and possible supply chain problems, there was no guarantee that accommodations could be made for students with food allergies.
So to address this issue, Celeste and I developed a policy with the help of Ms. Brown, of course. We developed a policy scan in which we can gauge the level of accommodations that are being made for food insecure individuals with food allergies across the country. And our data collection method includes two groups: those that are TAG members that will be contacting these school districts directly, and non-TAG members that would reach out to the wider community.
20% of children with food allergies experience food insecurity, and like we mentioned before, many assistance programs do not take dietary restrictions into account. So low-income members of the food allergy community are at a major disadvantage. As food insecurity has increased due to the general pandemic, this problem has and will continue to worsen. Our hope for this project is that it will not only raise awareness for food insecure members of the food allergy community in the current situation, but will also gather data in order to prepare for a similar situation in the future.
So how are we doing this? Right now, we have TAG members that are starting off by reaching out to their local school districts and seeing the level of accommodations that they serve. And then there's also, in addition to that, after they do that, they're reaching out to school districts within their assigned state. They specifically reach out to the head of nutrition services, and they send them an email using the email templates that we have on our toolkit that we've developed. And this includes emails such as first sending the email out and follow-up emails, and we developed this toolkit to make this process as easy as possible.
Data from both TAG members and members of the wider food allergy community are inputted into spreadsheets specific to each state. Our organization system makes sure all contact information is recorded, both of the school district and the original contactor, and we have developed 3 basic response categories. The first is that a school district is unable to accommodate food allergies due to limits of their own situation or because they are unaware. So basically our first category actually has 2 subcategories. And the second category is that they are able and aware of the situation and are able to make accommodations.
So what do we hope to achieve through this project? Through the data that we collect, we can use this to make infographics, geomaps, percentages, basically viable data that we can present to policymakers, and that will emphasize the need for policy and change to be made for those with food allergies and who are also food insecure. And hopefully through the data that we collect, we can create real change.
So I started Food Equality Initiative after a personal experience with food insecurity and food allergy. Both of my children have food allergies, including eosinophilic esophagitis. And after experiencing the limited selections through the WIC program and other federally qualified nutrition assistance programs and the lack of resources through the charitable system, FEI began working to make critical change. We have three main areas of focus. That's on access to safe and healthy food, education, particularly nutrition education and disease management education, and then advocacy so that those policies can create real sustainable change. We currently provide assistance for individuals impacted at the intersection of food insecurity and food allergies. Currently, we're utilizing a direct-to-door model, which allows those individuals to select the foods that they need to adhere to their prescribed diet and then have it delivered direct to their door. This is truly an unmet medical need. And so we are working to ensure that all individuals diagnosed with food allergies have the resources they need to thrive. Next slide, please. So what's exciting about this policy scan that FAFI has created is that this data will be used to influence changes through federal nutrition programs. One of the biggest challenges is through the summer meals program, which is currently being used to distribute meals, to-go meals to families in need during the pandemic. One of the challenges is that the summer meals program, although it provides meal replacement, those feeding sites that utilize the program don't get any additional reimbursement dollars to accommodate students with food allergies. So this data is important because it gives us a baseline understanding of how many providers through this program are making accommodations and can hopefully influence additional funding to support accommodations. The other program that we hope to impact by this is the TFAP program, which stands for the Emergency Feeding Food Assistance Program, which is basically a commodities program through the USDA. Currently, there is no minimum percentage of commodities that must be free from the top 8 common allergens. And so one of the things that we're recommending is that there is a minimum percentage to ensure that these TFAP foods that are often distributed at food banks and at senior citizen centers and daycares, that they are accessible to individuals with food allergies who must avoid common allergens. And we also believe that labeling should be clear on these foods as well.
So, as of September, we have finished data collection for the state of North Carolina and are currently focusing on the states of California and Connecticut. We're hoping to expand our project and we welcome all who are interested, whether you're a TAG member or a member of the general public. We've designed this project to not be too time-consuming, and the structure of the policy scan will help develop skills in outreach and data collection, both of which are highly valuable in professional environments. This is a potential resume building opportunity for many students and also demonstrates interest in advocacy and research. We wanted to thank everyone who was involved in this project, especially all of our team members, and we wanted to say a big thank you to Ms. Brown for helping out and mentoring us throughout this journey and this time. Anissa, do you have anything to add?
No, it would be greatly appreciated if you guys would sign up for a policy scan, help out. Once again, it's not too time consuming, and we're really trying to make this project more widespread and do as many states as possible. So any help or any participation would be greatly appreciated. Thank you.
And one last thing, you can check us out at our Instagram at fa_a__fee or our email fafiteamofficial@gmail.com.
Hello everyone, my name is Shreya Shivakumar and I'm the founder and president of Nourish America, a nonprofit organization based in New Jersey which provides allergy-friendly food to people in need. I'm also a member of the FAIR Teen Advisory Group and a Girl Scout ambassador currently working on my Gold Award for educating children nationwide about food allergy safety. I'm here to talk about food insecurity and what Nourish America has done to alleviate this issue and how everyone can make an impact in reducing hunger. Food insecurity is extremely prevalent in America and has risen to unprecedented levels since the coronavirus crisis began. In fact, 1 in 7 Americans rely on food pantries for their daily meals. However, hunger within the food allergy community isn't a problem that's often in the spotlight. The average gluten-free alternative is over 242% more expensive than its regular counterpart. Buying these allergy-friendly alternatives can pose an economic burden to families already in financial need. This issue affects over 2 million Americans who live in poverty with food allergies or celiac disease. You may be wondering, what factors influence people's access to allergen-free foods? Firstly, there's economic barriers. The cost of food allergies is estimated at about $25 billion annually. Moreover, federal assistance programs such as food stamps or WIC do not provide the financial resources necessary to afford many of these foods. Some people face problems with accessibility, where there's a lack of transportation or language barriers that prevent them from obtaining allergy-safe foods. There's also a stigma at food banks against people who ask for allergy-friendly foods. I volunteered at a food bank for 2 years in high school and noticed that people with children who had food allergies had trouble finding allergy-safe options to take home. This experience, coupled with my family's personal experience with food insecurity during my childhood, were the main personal motivators for creating Nourish America. Nourish America is dedicated to providing allergy-friendly food to families in need. Since our founding in December 2018, we have been working towards our mission to end hunger for all. We are an entirely youth-led organization. This is the Nourish America team. The 6 of us work together to coordinate allergen-free food drives, plan fundraisers, and monitor our Instagram account. Here is an overview of our allergen-free food drives. First, we contact local food banks and inquire about what allergen-free foods they need the most. Next, we contact a business or organization to partner with for the food drive. We've done drives with religious organizations, schools, and supermarkets, including ShopRite. Once we collect donations, we sort through the items to verify that they're free of that specific allergens and also free of cross-contamination with that allergen. Finally, we deliver the donations to the food bank so that they can distribute them to the families that need them the most. Here are pictures from our previous food drives. We've done 5 allergy-friendly food drives in the last 2 years and donated about 1,200 pounds of food to communities in need in the tri-state area. In the past, we have collaborated with the Community Food Bank of New Jersey, Middlesex County Cares, and the Refugee Assistance Partners of New Jersey. This past March, I learned that 100 refugee families were struggling with food insecurity due to the coronavirus. For context, I volunteer with an organization called the Refugee Assistance Partners, and I have worked with these families in the past. Me and my team got to work organizing an online fundraiser and virtual benefit concert to provide the refugees with food. We were able to support the families with over 800 pounds of fresh produce and groceries in the following 4 months. Fortunately, they are all doing well now, and we are so glad that Nourish America could assist them in a time of need. Here are some milestones of our organization. Last month, we hosted the 2nd annual Notes for Nourish benefit concert to raise $800 towards allergy-friendly food for families who have been affected by the coronavirus. Notes for Nourish is an annual tradition that we organize at Nourish America. Last year, we did it in person at the Old Franklin Schoolhouse in Metuchen, New Jersey. And this year, we did it virtually via YouTube premiere. It is a community event and a great fundraiser featuring talented youth musicians. Across the 2 concerts, we were able to raise over $1,300 to provide allergy-friendly foods to communities in need. In the future, we expect to hold more allergy-friendly food drives to support food banks in the Northeast, and especially assist families who have been affected by the coronavirus. We are planning to establish new chapters of Nourish America across the nation to expand our impact. We are also educating Generation Z about food allergies using social media accounts. If you want to learn more, follow Nourish America on Instagram or visit nrshamerica.org. That wraps up our presentation. If you have any questions or you're interested in starting a Nourish America chapter, please feel free to contact us through email. Thank you so much for listening, and I hope you enjoy the rest of the webinar.
Hi guys, my name is Indrani Matra. I'm a junior from Houston, Texas, and I'm so excited to talk about a program that I created called Allergy Friendly Choices today. So I was actually volunteering for an organization called Kids Meals with my class when I realized that the lunch bags that we were making, the food that we were putting in them, I couldn't have most of that due to my food allergies. And that got me thinking, how did families that experience both food allergies and food insecurity gain access to safe foods? Was a hunger the alternative for a child who had peanut allergies and couldn't have the peanut butter and jelly sandwich that we were making him? And so I started researching, and I learned that food allergies are an often overlooked dimension of food insecurity. Of the 60,000 pantries in the United States, only 4 accommodate for food allergies. And this gap is what inspired my service learning project called Allergy Friendly Choices, which seeks to provide a safe food to folks who experience both food insecurity and food allergies or celiac disease. So we know that food insecurity becomes an especially formidable challenge when intersected with food insecurity or food allergies and celiac disease. One main reason is the financial burden of food allergies. We know that food allergy-friendly foods are significantly more expensive than regular foods. And also, federal nutrition assistance programs like WIC and SNAP, they don't accommodate extensively for food allergies. So many often turn to charitable food supply. And finally, children with food allergies in the lowest income stratum spend 2.5 times more on emergency department and hospitalization costs due to food allergies, and particularly due to limited access to allergen-friendly foods. So we already have this need, which is only amplified in the context of the COVID-19 pandemic. According to the Household Pulse survey, as of week 11 of the pandemic, food scarcity had increased about almost 11% in the US. In 2019, the incident rate of food allergies was 8% in children and 5% in adults, according to the CDC. So since food insecurity has increased, the number of families with food allergies and food insecurity is likely to have also increased. So it's crucial to ensure that these families have access to the necessary foods. I want to talk about how AFC is designed to operate as a targeted resource. My family, like many others, used to donate allergy-friendly foods to local food banks or food pantries. But then I realized that these donations might be getting mixed up with the general donations and not reaching the target population. So what AFC does is that it works with existing pantry clientele and the existing networks to create a targeted supply of food for folks with food allergies and celiac disease. So allergy-friendly food can go to the people who need it the most. So I met March of 2020 with the Houston Food Bank to discuss possible ways as to how AFC might operate. The special programs team had suggested that I collaborate with an HFP partner pantry in the Houston community as a pilot site for AFC. And we had also decided that AFC would operate within the Food for Change / Food RX program, which is an HFP program that seeks to address the root causes of food insecurity. So basically, clients receive a food prescription or a food RX card, and when referred to by a community health partner. So if they have if they are diagnosed with food allergies or celiac disease in this case, and then they can redeem this food RX card at Food for Change markets, where they can select 30 pounds of free fruits and vegetables plus 4 additional allergy-friendly foods. Right now, as I said, they can choose 4 allergy-friendly foods through client choice markets with their card. And right now, at the current pilot site, which I'll get into later, we have access to 6 pantry shelves and 1 fridge shelf. Currently, AFC is piloting at West Houston Assistance Ministries, or WHAM, which is an HFB, which is Houston Food Bank distribution hub that serves a mostly minority community clientele. They actually won the Food for Change Market of the Year Award in 2019. And here's a fun fact: August 18th was officially declared WHAM Day by Houston because of all the great work they've done. So it's already a great choice. But the best part is that they had already accommodated 4 special diets through their client choice pantry. So it really is like just a great choice, like a great pantry to incorporate AFC into. So obviously the COVID-19 pandemic happened, and the client choice pantry at WHAM had to close down due to social distancing guidelines. AFC had to adapt. So I worked with the pantry director at WHAM, Ms. Brita Duncan, who's great, to incorporate AFC into the drive-through distribution that was happening there at WHAM once a week. So basically, we make these AFC bags at home based from donations. Clients are asked at families indicate whether they need allergy-friendly or gluten-free choices at registration. It's now a question that they ask at registration. And then a volunteer writes G or A on their car. So when they go through the driveway, if they have G or A, they're given 1 AFC food bag. I also created multilingual yard signs that we placed across the drive-through route to alert WHAM clients of this new resource availability. So here are some examples of AFC bags being handed out to clients. We have 2 versions, allergy-friendly and gluten-free, and it contains a week's supply worth of food. So 1 starch, 1 savory and sweet snack, and 1 breakfast option. So I'm going to talk about publicity for AFC and how I've raised awareness to both the clients about this research and potential donors. I created a website called afchoices.org, and I have Instagram at Allergy Friendly Choices, Twitter, which is like my normal Twitter, allergyism_101, and I also regularly post on local food allergy/celiac disease groups. And also I've been working with the Director of Development at WHAM to regularly publicize AFC through WHAM's social media efforts to both potential donors and clients. To make food donations easy and efficient as possible during the pandemic, I created an Amazon wish list where donors can just click on the foods that they want to donate and it's delivered to me. And I use the deliveries to make bags for future AFC distributions. So as of August 2020, we have $1,035 raised in donations, and nearly $700 worth of allergy-friendly and gluten-free food has been donated. And also, we've been doing the distribution for 6 weeks, and over 100 AFC, we've distributed over 100 AFC bags to WHAM clients. It's very, very exciting. I'm going to talk about what lies ahead for AFC. Post-pandemic, Houston Food Bank First is open to figuring out a sorting protocol where gluten-free items will be separated and earmarked for AFC partnered pantries like WHAM at the principal sorting facility. And one thing that happened very recently, very good, is that Houston Food Bank actually added an allergy-friendly, a food allergy and celiac disease question to their needs assessment sent out to clients. So that's a really great hallmark for progress in food allergy awareness in food banks. Considering that they didn't even know that this was a problem when I came to them in March. It's a really big deal, and I'm really excited. Of course, I want to expand to other Food for Change hubs in Houston, and I hope that AFC can become a part of a network of Food for Change pantries throughout Houston, so we can expand as much as possible. How can you start a program like AFC? Well, first I got the seed money through a school grant, so I got really lucky. Look and see if there are any local community service grants, or through your church or whatever organization maybe that you're a part of, or raise some money on your own through an allergy-friendly bake sale or something. And so once we have, you know, the seed money, you have to research a lot. You have to research a lot because a lot of people don't know that this is a problem. So we need to have, like, you know, statistics showing that there is a need for a program like this to divert resources to a program like AFC. And also research the local food bank programs that AFC could possibly be incorporated into. You know, I had like a whole table of, like, you know, this program, you know, how if a program like AFC were to be included into it, how would it work, you know, because it'll show them that you're really serious. And also it makes things a lot easier and a lot more efficient because you're incorporating this program into something that's already well established. Connect with a local food pantry that specifically mentions, like on their website or in their description, serving special diets. That is always a great place to start. And make sure that it's like a client choice format pantry, which like the food bank norm is slowly shifting towards that because client choice, it's a lot easier to incorporate a program like AFC into a client choice format, you know, because again, clients are choosing what they need tailored to whatever their family, you know. And publicity is very important. Remember to regularly post on social media about, you know, this program, not only for potential donors, but also for the clients who need it, you know, so you can make the community aware about this resource availability because it's kind of like a newer thing. And finally, the most important thing is is ensuring long-term sustainability. You know, we want this to be like a reliable stream of safe foods for families who experience both food insecurity and food allergies, you know, which is why it's so important that you try to incorporate this into an already well-established program to make it, you know, as efficient and as reliable as possible. Thank you so much. Thank you to the Chapman family. The Chapman family provided me the seed money to start AFC. Thank you so much to WHAM and Houston Food Bank, of course, for launching AFC, you know, and just helping me so much throughout this process. Thank you to Mrs. Sandhya Samnani, who is a food allergy mom and mentored me throughout this project. I'm so incredibly grateful for her. She's just amazing. And of course, to Fair for allowing me to share my experience and everything with you guys. And also for the Living Teal Spotlight Award that I'm just so tremendously grateful. Thank you so very much to everyone, and I hope you guys all have a lovely day. Bye-bye.